Welcome to this lecture, Blood Coagulation. Today we are going to learn about blood clotting and coagulation. Before I start the topic, let us take a glance at blood components. RBCs, WBCs and platelets collectively constitute 45% of blood and rest 55% is plasma. Fibrinogen is a protein which is present in blood. It is responsible for coagulation of blood. Actually, coagulation is a natural defense process for preventing blood loss from body in case of injury and accidents. The process of blood coagulation is the formation of blood clot. It is an important part of hemostasis, which refers to any process that stops bleeding by clot formation in injured vessels. This includes physiological process in the body and also pathological process resulting in uncontrolled bleeding. Platelet activation. The blood circulating in the vessels does not clot under normal circumstances. The blood coagulation process is stimulated when there is an damage to the endothelial of blood vessels. It leads to platelet activation and and aggregation. When collagen is exposed to the platelet due to injury, the platelet binds to the collagen by surface receptor. This forms additional cross-linking and activation of platelets, which facilitate tight binding and aggregation of platelet at the site of injury. This leads to primary hemostasis. Blood coagulation pathway. The process of blood coagulation leads to hemostasis, prevention of bleeding and hemorrhage. Blood clotting involves activation and aggregation of platelets at the site of exposed endothelial cell, followed by deposition and stabilization of cross-linked fibrin mesh. Primary hemostasis involve platelet aggregations and formation of plaque at the site of injury, and secondary hemostasis involve strengthening and stabilization of platelet plaque by the formation of network of fibrin threads. These secondary hemostasis involve the coagulation pathway, the intrinsic pathway, and the extrinsic pathway. Both pathways merge at the point and lead to the activation of fibrin and the formation of fibrin network. So ultimately, overall, this cascade involve the 13 clotting factors like calcium mineral and potassium vitamin, which is responsible for clotting. And at the end of the process blood clots and prevent blood loss from the body. That is very important because blood is a fluid of life. Here in this flow chart, you can understand the blood clotting process. The first step is injury or damage to the epithelial cell. Next step is vasoconstriction, which attract the platelets to stick and it form the plug. And ultimately the fibrinogen convert into fibrin threads and it make a network of fibrin threads and ultimately it leads to the blood clotting. Thanks for listening.